Chronic use of amiodarone increases the risk of what? Fatal pulmonary disease. What's the buzzword for hamartomas? Popcorn calcifications. And it's benign, by the way. Note that sunblock can prevent sunburns. And if you see an image of someone's face, don't automatically assume melasma or Addison's. They could just have a sunburn. So keep that on the differential. What is the likelihood of returning to work after back pain be predicted by? By a patient's recovery expectations. Contact dermatitis is common for people who wash their hands too much. Okay? Like dishwashers or nurses and doctors, car washers. What will you see on a smear of someone with mono, blood smear? Atypical lymphocytes. What is the effect when study participants act differently because they are being watched? That's the Hawthorne effect. Can SIADH cause hyponatremia? Definitely. SIADH can cause hyponatremia. What is the most common cause of secondary dilated cardiomyopathy? Coronary artery disease is the most common cause of secondary dilated cardiomyopathy. What is the best IUD for a patient with lupus or antiphospholipid antibody syndrome? That would be a progestin releasing IUD for someone with lupus or antiphospholipid antibody syndrome. Note that kids might manifest bereavement in strange ways, like seeing or actually like not understanding what death entails and the consequences of it. If you think a patient is lactose intolerant, what should you get them to stop doing? Get them to stop eating dairy for the most part, right? I'm going to say some things and you tell me what these are. If a blood pressure is over 160 over 100, or they have thrombotic events in the past, or it's a 35-year-old female with 15 plus cigarettes usage, or has migraines with aura, all those things, what are they? Contraindications to OCP use. If you have a patient that has vaccine hesitancy and you want to talk more about it, when? At the next well child visit for the most part, or the next visit, right? Respect them, respect their views and opinions, but vaccines, yeah. If you have a patient that's calling you at inappropriate times and all that, you should say something like, I appreciate your efforts to reach out, but let's review what an urgent call should be used for. If you have a female patient with pubertal gynecomastia, you should just reassure them and follow up, okay? What is a measure of risk that shows the chance of an event happening in one study arm compared to another study arm? That is a hazard ratio. Note that phenytoin toxicity can cause eye issues, make you feel dizzy and drowsy. So when that happens, you need to decrease the dose of phenytoin. What sort of bladder issue is the most common complication of spina bifida? Neurogenic bladder. is the most common complication of spina bifida? A patient with rhabdomyolysis should get what? IV fluid. What are non-inferiority trials used for? Non-inferiority trials are used to see if a drug of interest is worse than the drug that's commonly being used, or a drug that's known to be fine or whatever. Depressed patients with suicidal ideation but no intent or plan, do they need to be hospitalized? No. So if you're in the ER, patient's like, I want to kill myself, you ask them, do you have a plan? They say no. Great. Do you intend to kill yourself? They say no. Great. So they don't need to be hospitalized under that situation. Note that things that are pretty obvious, like support structures and family, those are protective factors against suicide. If a paranoid person is in your clinic, what personality disorder should you be aware of? It's obvious. Paranoid personality disorder. In general, what does the management of DKA require? Short-acting insulin or long-acting insulin? Short-acting insulin. How do you treat acute otitis externa? Treat it with antibiotic ear drops. If you think a person is on steroids, what should you try to get them to do? Stop it, right? Stop the steroid use. In general, you should be available to counsel patients, within your respective specialty, of course. Refer drug-using patients to the appropriate level of intervention program. If you're in gynecology or OB-GYN and the labor for your patient is taking too long, you should give them oxytocin. So beware of greater than or equal to 6 centimeters or less than 1 centimeter per 2 hours. If a person gets salmonella from raw eggs, but they're not symptomatic and they're older than 1, do they need antibiotics? Nope, they do not need antibiotics. So, yeah. Post-operative urinary retention is a common side effect of anesthesia in a surgical patient. So beware of that. Post-operative urinary retention. That's why a lot of patients get what during surgery? They get a bladder cath, right? What's the first line treatment for depression? SSRIs. If you have a patient that's not been vaccinated for hepatitis and you have concern that they've been exposed to it, what medications should you give them? Hepatitis B vaccine and the hepatitis B immunoglobulin. If your patient has dot-like red rashes on their palms, what should you be concerned for? Syphilis. What is the most common inherited thrombophilia? Factor V Leiden is the most common inherited thrombophilia. If a patient has angioedema with ACE inhibitors, what should you consider as another medication? ARBs. Do you know an example of an ARB? Losartan, right? If you have a teen girl with abdominal pain that's never had a period, what should be on your differential? Hematocolpos secondary to an imperforate hymen. What medication helps treat alcohol withdrawal? Lorazepam helps treat alcohol withdrawal. Weight loss surgery is good, like, gastric bypass, but certain criteria need to be met. So, what does their BMI need to be just in general without any other secondary things? Greater than 40, right? Or if their BMI is greater than 35 and they have a comorbidity like knee arthritis or something like that, secondary to their BMI, then they are also candidates for bariatric surgery. And that's that.